Alrighty. So our next topic for our pediatric section is going to be our neonatal and infant heads. So I know a lot of people get scared of these, especially if you've never been down to the NICU before and you see just how small these premature babies are, and it's you can be really taken back, just about how delicate and fragile these little kids are and how small they are. And but this exam is actually pretty important because we're looking for cerebral hemorrhage or brain bleeds, which can often happen with premature infants. So it's a study it's often ordered quite often, particularly if your hospital has a neonatal intensive care unit. But they're not that difficult, as long as the images that you need to acquire and the pictures that you need to obtain. You're essentially just doing sweeps. So the exam itself isn't that particularly difficult. Just know your anatomical landmarks and being able to recognize your different grades of bleeds. We'll get into a little bit further, but a grade 1 bleed can be challenging to see, and that's when the radiologist usually will make that call. But a significant bleeds are definitely obvious. So a little bit on the embryology of the brain. So the brain begins as a neural tube. So the neural plate develops at 18 to 20 days after conception. The neural plate forms into a neural tube and a neural crest. The neural tube will then differentiate into the central nervous system, which consists of the brain and the spinal cord. And the neural crest gives rise to the peripheral nervous system. So that neural tube will continue to differentiate. The lumen of the neural tube becomes the ventricular system of the brain cranially and the central canal of the spinal cord caudally. At about 4 weeks of gestation, the neural tube will differentiate into 3 primary brain vesicles. So you have the prosencephalon, which is the forebrain, the mesencephalon, which comprises the midbrain, and then the rhombencephalon, that's the hindbrain. So then you get further differentiation at the end of week 5. And then this chart shows your primary brain vesicles. So your prosencephalon, what they turn into in the mature brain. So that's going to be your thalamus, your epithalamus, hypothalamus, and subthalamus, as well as your cerebral hemispheres. So that consists of the cortex and medullary center, the corpus striatum, and the olfactory system. So your mesencephalon develops into your midbrain, and your rhombencephalon, or your hindbrain, develops into your medulla, your pons, and your cerebrum. I'm sorry, cerebellum. Apologize. So these are some more anatomical structures. I actually just found in one of the textbooks a nice list of like all the anatomical structures and some descriptions. So I'm going to upload that during the break to D2L. But anyway, so The most important anatomical structure, that in terms of this cerebral exam is going to be our fontanelles. So we have two fontanelles. We have the anterior fontanelle and a posterior fontanelle, which is much smaller. As you can see, the anterior fontanelle is much larger. And this is the fontanelle through which we're going to acquire our images. You can potentially scan through the posterior fontanelle, but the posterior fontanelle closes sooner and is much smaller. So this is our landmark. This is where we're going to be scanning or acquiring our images from. In addition to this anterior fontanelle, we do acquire mastoid views, which I'll show you a little bit later. But this is where the majority of our images are going to be taken from. So with our anterior fontanelle, we do have some sutures that are associated with it. So these are our coronal sutures. So think of it like a corona, like running along this view. So when you get into taking your images between coronal images and sagittal images, so corona, think of it like a crown, how a crown sits on your head, whereas sagittal will run anterior, posterior, and you're scanning from lateral to medial. So coronal views will run anterior, posterior, and kind of like a crown. So you're tilting anterior, posterior. So then from the connecting the anterior fontanelle and the posterior fontanelle, you have your sagittal suture. And then coming off the posterior fontanelle, you have your lambdoid sutures. So neonate fontanelles are not closed completely. The anterior fontanelle is located at the top of the neonatal head and it's felt as the soft spot. If the baby has a condition called hydrocephalus, the anterior fontanelle may be bulging. If there's overlapping of the cranial bones, fontanelles may be difficult to palpate and provide limited windows for transducer imaging through the cranial sutures. So remember those plates before those sutures fuse, they're free floating, they're moving, and that helps to allow during pregnancy, for the squeezing of the skull and allowing the baby to pass through the pelvic canal, through the pelvic bone. So those plates can actually shift on top of each other, and thus, creating a closure or an abnormal closure of that fontanelle, or a very narrow fontanelle through which you have to scan. So transducers placed carefully on the anterior fontanelle to record multiple images of the brain in coronal, axial, and sagittal planes. So fontanelles are spaces between the bones of the skull, which allow for compression at birth and rapid growth of brain thereafter. So you can see your anterior fontanelle and your posterior fontanelle. So meninges. So these are the three membranes or meninges that surround and form protective covering of the brain. So the three meninges or three membranes are going to be your dura mater, arachnoid, and pia mater. So the dura mater is a double layered outer membrane that forms the toughest barrier. Another structure is your falx cerebri. This is a fiber structure separating the two cerebral hemispheres. So the falx cerebri separates the right and left hemispheres of the brain. So it runs centrally down the middle of the brain, separating right and left. Your tentorium cerebelli is a V-shaped echogenic structure separating the cerebrum and the cerebellum. This is an extension of your falx cerebri. So this image here is a cross-sectional image. So we are actually in a coronal plane. So this would be your falx cerebri running down the middle of the brain. So you have right hemisphere and left hemisphere. And then you can also see your different meninge layers. So you have your pia mater, which is represented here as the inner layer. You have your dura mater, the outer layer here in the yellow. And the arachnoid space in between. So the arachnoid is the space between the pia mater and the dura mater. So this is a good picture, coronal picture also. And you see blue here, this is your superior sagittal sinus. So that's going to be venous flow, where the venous flow collects in that superior sagittal sinus. So that's going to be another image that you're going to require as part of your exam, but we'll get into that. So the brain also has the ventricular system. So the ventricles, which are cavities for the cerebral spinal fluid. So the lateral ventricles are the largest of the cerebral spinal fluid cavities located within the cerebral hemispheres. So we have two lateral ventricles. So there's a right and left lateral ventricle. They are located on either side of the brain. So the lateral ventricles communicate with the third ventricle through the interventricular foramen. And the lateral ventricles are divided into 4 segments. So we have a frontal horn, a body, occipital horn, and a temporal horn. So this is a picture showing the ventricular system. So again, these are collections or reservoirs for cerebral spinal fluid. So you could see, one of the lateral ventricles here. So you have your anterior horn of the lateral ventricle, the body, so trigon area. So this portion that sticks back is the occipital horn. And then we have our temporal horn of the lateral ventricle coming down this way. So over here, this is our third ventricle, and we have a connection between the lateral ventricle and the third ventricle through this interventricular foramen, also called the foramen Monro. Then our fourth ventricle is located down here. And there's connection between the third and the fourth ventricle through the aqueduct of Sylvius. So the atrium or trigone is the site where the anterior occipital and temporal horns join together. The body of the lateral ventricle extends from foramen of Monro to the trigone. So body. The corpus callosum forms the roof, and the cavum septum pellucidum forms the medial wall. The thalamus touches the inferior and lateral ventricular wall, and the body of the caudate nucleus borders the superior wall. Sorry. The temporal horn extends anteriorly from the trigone through the temporal lobe. Roof formed by white matter of the temporal lobe and tailed by the caudate nucleus. The hippocampus forms from the medial wall. And the occipital horn extends posteriorly from the trigone. The occipital cortex and the white matter form from the medial wall. And the corpus callosum forms the proximal roof and the lateral wall. The frontal horn is divided posteriorly by the foramen of Monro near the body of the ventricle. The roof again is formed by the corpus callosum. The septum pellucidum forms the medial wall and the head of the caudate nucleus. And head of caudate nucleus forms the lateral wall. So the third ventricle is connected by the foramen of Monro to the lateral ventricles. The aqueduct of Sylvius connects the third and fourth ventricles. And the medulla oblongata forms the floor of the fourth ventricle. The roof formed by the cerebral vermis and the posterior, the roof it's formed by the cerebral vermis and the posterior medullary velum. The lateral angles of the fourth ventricle form the foramen of Lusca. Inferior angle, foramen of Meningi. Menendi is continuous with the cerebral canal, the central canal of the spinal cord. So I'm going to go over a little bit later. You know, that was a lot to like digest, but it's easier when you're able to see it in your pictures and appreciate, you know, your different structures. So cerebral spinal fluid, or CSF, surrounds the brain and the spinal cord and protects it from physical impact. Approximately 40% of cerebral spinal fluid is formed by the choroid plexus of the lateral, third, and fourth ventricles. The remainder is produced by extracellular fluid movement through the body, or from the blood through brain into the ventricles. Fluid from the lateral ventricles passes through the foramen of Monro to the third ventricle. Fluid then passes through the aqueduct of Sylvius to the fourth ventricle. And fluid may then leave through the central foramen of Menegdi or the lateral foramen of Lusca into the cisterna magna and the basal subarachnoid cisterns. So cerebral spinal fluid flow. Anterior flow continues upward through the chiasmatic cisterns, the Sylvian fissure, and the pericallosal cisterns up over the hemispheres, where it is reabsorbed by the arachnoid ganglionations in the sagittal sinus. Let's see. The picture up here showed it. So posteriorly, cerebral spinal fluid flow moves around the cerebelly through the tentorial incisure, the quadrigeminal cistern, the posterior callosal cistern, and up over the hemispheres. A small amount flows down the spinal subarachnoid space. So the cavum septum pellucidum. This is a thin triangular space filled with cerebral spinal fluid and lies between the anterior horn of the lateral ventricles and forms the corpus callosum. The anterior to the corpus callosum, it's located anterior to the corpus callosum. So the cavum vergi is found at posterior extension of the cavum septum pellucidum. The cavum septum pellucidum is present at birth and closes within 3 to 6 months of life. So this is going to appear as the cavum septum pellucidum. It's going to appear as this is going to be a midline structure. It's going to appear anechoic fluid filled structure. It's going to be projecting superior anterior to the third ventricle and lies between the frontal horns and bodies of the 2 lateral ventricles. So choroid plexus. So this is a mass of specular cells located in the atrium of the lateral ventricles. Cells regulate intraventricular pressure by secretion and absorption of cerebral spinal fluid. And the glomulus is tail of the choroid plexus and a major site for bleeding. So for choroid plexus, so this consists of 2 curvilinear echogenic structures that arch around the thalami anteriorly and form the floor of the body of the lateral ventricles. Note that the choroid plexus does not extend into the frontal or occipital horns. Example, chart showing the choroid plexus. So here the stars are indicating your choroid plexus. So they appear as these echogenic, like linear curvature structures that arch around the thalami. So the cisterns, these are narrow subarachnoid space surrounding the brain and spinal cord and contain small amounts of fluid. The subarachnoidal cisterns. These are spaces at the base of brain where arachnoid becomes widely separated from pia, giving rise to large cavities. The cisterna magna is one of the largest subarachnoid cisterns. It's located posterior fossa between the medulla oblongata and the cerebellar hemispheres and the occipital bone. So cisterns, think of them as subarachnoid spaces surrounding the brain, and they contain small amounts of spinal fluid. All right, so our cerebrum. So we have two cerebellar hemispheres connected by the corpus callosum. They extend from the frontal to the occipital bones above the anterior and middle cranial fossa. Posteriorly extend above the tentorium cerebelli, separated by a longitudinal fissure into which projects the falx cerebri. So the cerebrum consists of gray and white matter. The outermost portion is the cerebral cortex, which is composed of the gray matter. The white matter is located within the cerebrum. The largest and densest bundle of white matter is going to be the corpus callosum. So this is showing a breakdown of the cerebrum: frontal, parietal, occipital, and temporal. So the cerebrum has a series of gyri. So are convolutions on the surface of the brain caused by infolding of the cortex. Sulcus are grooves or depression on the surface of the brain, separating the gyri. Sulcus further divide hemispheres into frontal, parietal, occipital, and temporal lobes. So there are fissures located within the cerebrum. We have our interhemispheric fissure. This is area in which the falx cerebra sits and separates the two cerebral hemispheres. We also have the sylvium fissure located along the lateral most aspect of the brain, area where the middle cerebral artery is located. So this shows cerebrum, the corpus callosum. So this is our sylvium fissure, lateral, and hemispheric fissure, be separating the two lobes from right and left. The quadraminal fissure is located posterior and inferior to the cavum virgae. The vein of Galen is posterior, or vein of Galen is posterior. Doppler should be performed to make sure it is a fissure and not an enlarged vein of Galen. So corpus callosum. So it forms broad bands of connecting fibers between the cerebral hemispheres, forms the roof of the lateral ventricles, and sits superior to the cavum septum pellucidum. Development between the 8th and the 18th week of gestation, beginning ventrally and extending dorsal. So this anechoic portion is going to be your cavum septum pellucidum. Your corpus callosum sits above it. So this green represents your corpus callosum. So your cavum septum pellucidum is the anechoic. Cerebrum. So the anterior body of the corpus callosum develops earlier than the genu. If uterine insults occur, development may be partially arrested or complete agenesis may occur. If partial, then genu, splenium, posterior, the posterior element, and the rostrum are absent. This is known as agenesis of the corpus callosum. So the basal ganglion is a collection of gray matter that includes the caudate nucleus, the lentiform nucleus, the claustrum, and the thalamus. The caudate nucleus, so that forms the lateral borders of the frontal horn of the lateral ventricles and lies anterior to the thalamus. The caudate nucleus is divided into head, body, and tail. The head of the caudate nucleus is a common site for hemorrhage. Caudate nucleus and the lentiform nucleus are the largest basal ganglia. They serve as relay stations between the thalamus and the cerebral cortex. The claustrum is a thin layer between the insula and lentiform nucleus. And the thalamus consists of two ovoid egg-shaped brain structures situated on either side of the third ventricle and superior to the brain. Borders of the third ventricle connect through the middle of the third ventricle by the massa intermedia. The hypothalamus forms the floor of the third ventricle. The pituitary gland is connected to the hypothalamus by the infundibulum. The germinal matrix includes the periventricular tissue and the caudate nucleus. Germinal matrix is located 1 centimeter above the caudate nucleus and the floor of the lateral ventricles. Sweeps from the frontal horn posteriorly into the temporal horns. And it sweeps from the frontal horns posteriorly into the temporal horns. So So basal ganglia, so the head of the caudate nucleus at the caudothalamic groove or notch. So this is the caudate nucleus. Here's this notch that we get. So this is going to be a common site for where a bleed might occur. Brainstem. Brainstem consists of the forebrain, spinal cord, consists of midbrain, pons, and medulla oblongata. The medulla oblongata, I'm sorry. Midbrain. So narrow connects the forebrain and the hindbrain. Has two halves called cerebral appendicules. The cerebral aqueduct is a narrow cavity of the midbrain that connects the third and fourth ventricles. The tectum is part of the tegmentum located behind the cerebral aqueduct. Tectum has four small surface swellings called the superior and inferior colliculi. The pons, this is found on the anterior surface of the cerebellum, this anterior surface of the cerebellum below the midbrain and above the medulla oblongata. Medulla oblongata extends from the pons to the foramen magnum, where it continues a spinal cord. Contains fibrous tracts between the brain and the spinal cord, and the vital centers that regulate important internal activities of the brain, such as heart rate, respiration, and blood pressure. So the cerebellum is composed of two hemispheres that have appearance of a cauliflower. Cerebellum lies in the posterior cranial fossa under the tentorium cerebelli, and the two hemispheres are connected by vermis. So here's cerebellum located over here. Cerebellum, three pairs of nerves track this. Cerebellar pendicles and connect the cerebellum to the brainstem. The superior cerebral pendicles connect the cerebellar pendicles connect the cerebellum to the midbrain. Middle cerebellar pendicles connect the cerebellum to the pons. The inferior cerebellar pendicles connect the cerebellum to the medulla oblongata. Cerebral vascular system consists of internal cerebral arteries, vertebral arteries, and the circle of Willis. The middle cerebral artery is a branch of the internal carotid artery. The circle of Willis are often evaluated with Doppler ultrasound in determining cerebral blood flow patterns. For premature or sick infants, most neurosonography examinations are performed portably in the neonatal intensive care unit. So two key concerns are keeping the premature infant safe and warm. So we often perform these exams while they're in their isolettes, and use a small amount of gel while scanning through the isolette porthole, and make sure the gel is warm. Be aware of multiple wires or tubes and or monitors. So the neonatal exam head protocol. Small sector transducer with a 120-degree sector angle is used. So it's a little phased array transducer that we use. That's a sector, has multifocal capabilities used to image through the anterior fontanelle. This probe has a small footprint. It's typically a sector array that we use with a high frequency. And it's used to image the near field pathology from the anterior fontanelle. Remember, a lower frequency may be needed in older infants or with closing fontanelles or in infants with thick hair. A 3 to 5 megahertz transducer may also be necessary to visualize deeper structures. So overview for standard evaluation, sonography of the neonatal brain is initiated through the anterior fontanelle in coronal and sagittal views to study the supratentorial and infratentorial compartments. Posterior cranial bones should always be present in the standard images to ensure the entire brain is being visualized. The mastoid fontanelle is utilized to better visualize the cerebellum and the infratentorial compartment or the posterior fossa in young infants. Color Doppler is also used, and pulse Doppler when indicated, an evaluation of the pericallosal artery from the mid-sagittal view. The posterior fontanelle approach may also be useful for any critical neonate on ECMO, the extracorporeal membrane oxygenation, where mastoid view is unattainable. If imaging is restricted due to overlapping bones in the area of the anterior fontanelle, or pathology is suspected in the choroid plexus and lateral ventricles, the posterior fontanelle may also be used as an alternative window. So additional views of pathology may be obtained from the posterior mastoid fontanelle, the foramen magnum, or thin areas over the temporal and parietal bones. A linear array with a high frequency can also be used with and without a standoff pad. So these are often, a lot of the radiologists would also ask for you to do high frequency imaging. And so additional axial or coronal and sagittal views are obtained using a high frequency probe. So on average, a neonatal head exam will take 10 to 15 minutes when compared to a 1 to 2 minute with the 3D technique. So a three-dimensional neurosonography, this technique can reduce interoperator variability and significantly reduce the time required to perform a neurosonological exam. So coronal study. To perform the coronal study, a transducer is placed on the anterior fontanelle with the scanning plane following the coronal suture. So I'm just going to kind of skip over these and just kind of go through your views for the coronal. It's better to visualize them than me just reading these words. So our coronal plane, we're going to be slicing the brain in a coronal view. So we're going to be scanning from anterior to posterior. Um, so we're going to start by angling anterior towards the front of the face. So these are actually the orbits. So these are the orbital cones. So we're going to be angling as anterior as we can until we visualize the orbital cones. So you could see the frontal bone here. 4. One is going to be our interhemispheric fissure running along here. And we could see it's separated into right and left. And we're going to slowly take serial images, just slowly sweeping from anterior to posterior. So as we slowly work our way posterior, you're going to be taking serial images. Some places would like you to do clips. You'll now start to see the cavum septum pellucidum coming in. 10. You'll start to see the frontal horns of your lateral ventricles. You can see on either side, the frontal horns of the lateral ventricles starting to come in. You may also start to see the caudate nucleus. Caudate nucleus starts to come in as well. As you slowly continue to sweep back, you now continue to see the lateral ventricles. Again, you have your intrahemispheric fissure. So you want to make sure that your fissure lines up down the middle of your screen and your imaging, both sides of the brain symmetric. So as you continue down, scanning more into posterior, continue to have your lateral ventricles. In the middle here is going to be your cavum septum pellucidum. Start to see the thalamus coming in on either side. Your caudate nucleus, it's going to be on the lateral side over here, number 6. Continue scanning. Since you keep coming more posterior, now 15, these echogenic lines, these are going to be your chorioid plexus coming in on either side. If we go back up, we start to see, the lateral ventricles, the temporal horns of the lateral ventricles coming in. Starting to visualize the cerebellum. So you want to continue sweeping all the way through. Make sure that you visualize, the ventricles and the chorioid plexus. Continue posterior. Then you switch to a sagittal plane and you begin midline. Right. So you're going to begin midline with visualization of your cavum septum pellucidum. Let's see, where's our good midline picture? So 15 here is going to be our cavum septum pellucidum. And then we scan out either right or left. We begin to see the lateral ventricles coming in. So we have our anterior horn. It's going to be our notch that we look for. And you continue scanning out lateral, the chorioid plexus. Continue scanning outward. So you can also Doppler branches of the anterior cerebral artery. So this would be a very large dilated ventricle that you could see here. So there are some windows that you can get in your mastoid views for a posterior study. There we go. So this would be the sternum magnum. This is a posterior approach. I've personally never used that view through the sternum magnum. I've done mastoid views to image the cerebellum where you come just above the baby's ear and just posterior to the baby's ear where you have two windows. And you can get good images of the cerebellum through there. So you do a long and trans. I'm gonna upload some photos right now because I have some good pictures that show a lot of the anatomy as you're scanning through the brain. Stop share. So this was a good diagram that I found for your midline sagittal view. You see your cavum septum pellucidum, corpus callosum makes the roof. We see at the beginning of the third ventricle, fourth ventricle. So when we're looking for bleeds, it's going to be within the germinal matrix along the ventricles. So we're looking for bleeds basically originating in the area of the cavum septum pellucidum and the corpus callosum along the ventricles. So that's a So this is going to be your first midbrain picture, and then you're going to sweep laterally out to either side, just taking series of images. So you're just kind of like angling slightly, picture, 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 picture. Some labs will actually have you do a cine clip starting midline and just sweeping, right, left. And then you'll repeat that with a high frequency probe, sweep right, sweep left. So again, you want to optimize your image. You want to see the base of the skull to ensure that you're imaging the entire brain. Get as much of this in your full view as you can. So this is a quality image. You don't have a lot of wasted space. You've optimized your image well. This was another image. So these are your coronal views. Oh, I lost it. Screen share is paused. No. All right. There's no share. There we go. So again, this shows some of the structures as we're working our way from anterior to posterior. So your cavum septum pellucidum, starting with your anterior horns of your lateral ventricles. And you're slowly working your way more posterior as you go. So a lot of your bleeds will either develop in this area of your anterior fontanelles or along your choroid plexus and your lateral ventricles. So I don't want to get into pathology just yet. I'm going to upload, I actually have some worksheets for you guys to work on for the anatomy for the baby brains to help you. So I want you guys to just get familiar with like the normal anatomy and the views that you see, just the major landmarks and structures. And then we'll get into the pathology, like what the brain bleeds look like, what potential masses or cysts, would look like and where they would be located. There really isn't, it's not too difficult of an exam, but I just want you guys to become more familiar with like the normal anatomy for a normal neonate brain. And then we'll get into some pathology next week. So I'm going to upload a lot of the pictures I have. I have a couple more like this that have been nice labeled out that I'm going to add on to D2L, as well as some more descriptions of some of the features of the brain that I liked better than what was on the PowerPoint. I found some better descriptions. And I'll upload, I guess, an example of a protocol for you to review as well. So that's pretty much it for the lecture wise for normal anatomy. In terms of lab today, again, bring shorts. And if any of you didn't do the JRCDMS survey that Kathy had given out last week, she was just asking that you'd bring in that survey or complete that survey for her. If you lost a copy or need a copy, we can provide that for you. Questions about anything? Again, this exam's pretty easy. It's not too bad if the baby's cooperative and not moving a lot. Typically, these neonate babies are they don't move too much. Your pitfalls are, if they have maybe a breathing tubes or like, mask on, sometimes they're wearing like a mask. Other times they may actually have a shunt in, like maybe this baby does have a bleed and they have a shunt in, and then you're trying to scan around that. Sometimes they may not be in the best position. So you want to position to the baby. It's easier to have them lying on their back. Sometimes they'll have the babies lying on their stomach, and then you have to kind of orient yourself, and it's a little difficult. So if they're able to put the baby on their back, that's better for you. Just helps with your orientation. But yeah. I will see you guys then later this afternoon for Scan Lab.
Okay, thanks, Dan.
All right.
Bye.
Take care.
Good, Dan, thanks.